All right, so this is Dr. Prucz with Phoenix Plastic Surgery, and I'm with my patient here, Officer Dominic. So Officer Dominic came in to see me because he had issues with his left hand. Do you want to kind of tell us what happened there?
Yeah, so I was in an incident that, left me with some damage to my ulnar nerve, and that made it so that these fingers, these two right here, didn't feel, at all. I couldn't feel them, and then my pinky wasn't moving. It wouldn't function. I would close my hand, and it would just stay, open or kind of curved, but not working the way it should.
Yeah. So he came in to me, and the first time I met Officer Dom, basically, I would say, move your finger, and he couldn't do it. He couldn't move it, he couldn't feel it. So we got what's called a nerve conduction study. So a nerve conduction study basically tells us how a nerve is working. And it showed us that Officer Dom had compression of the ulnar nerve here in the cubital tunnel. The ulnar nerve passes through this area. There's actually 4 points of compression that are very well documented. He took him to the operating room, and as you can see here, these are his incision. It's not a long one. And we released those 4 points of compression. And then tell me what happened.
Yeah, I woke up from surgery, a little groggy. I was just like, wow, I can feel my fingers. They just moved, and they did what I wanted them to do. Yeah, so that was awesome. They're still working. So.
Yeah. So he came in today, and when I walked in the room, he goes, "I'm like, how you doing?" He goes, "Well, I'm doing great," and he's moving his fingers, and he's telling me he has sensation. So I got to tell you, that's not typical. So usually when we do an ulnar nerve decompression, a person does not just come in and start moving their fingers and have great sensation. That's completely atypical, which is basically why we're doing this video, because it's healing well on the back there, and now we're getting into physical therapy.
Yeah.
And starting a new job.